Hello, hello. So I'm here with my brother-in-law extraordinaire, Dr. Andy Leitner, who also happens to be an assistant clinical professor at City of Hope. He is a anesthesiologist by training and a pain specialist. Um, and I wanted to bring Andy on the podcast today to have a conversation about COVID. The reason being, first, Andy is incredibly bright and he's insightful. And when I talk to Andy, what I love about it is he has a very much glasses full approach to life. And in this situation, as it pertains to COVID, I've really enjoyed speaking with him because he's always able to find the bright light. So with that, I thought I'd start with an open question to you, Andy. What do you think about COVID? Like, how can you have such an optimistic, positive lens when it comes to this topic?
Thanks, Jessica, and thanks so much for having me on. You know, it's funny you mentioned the glass half full. There's this joke, which is the optimist calls the glass half full, the pessimist calls it half empty, but the engineer says the glass was just designed twice as big as it should be. And, you know, with that, we've had to engineer so much of our lives around this pandemic, and part of it is sort of an opportunity to reflect on should we be engineering so much of our lives, and is an opportunity to step back and see, you know, how we've been doing things. Is it the right way of doing things? So, you know, for how tiring so much of this has been, and especially dealing with lockdowns, I do think we probably share this with many. It has given us an opportunity to sort of take stock and have some perspective and what we are thankful for in terms of how society has run before the pandemic, and some of the things we may have lost and that we're sort of clawing back. As parents of young children, we experience that with schooling, but there's so many other areas where it sort of takes stock in how precious family time is and how precious it is to be outdoors. So those are a lot of things that I've been thinking about in the last couple of years. I think all of us do to some extent, but also it helps tune out the noise because, you know, we are being a bit manipulated in order to sell ads and to sort of commoditize the news cycle. Is it helpful for us psychologically to know what, you know, today's case rate is and hospitalization rate, as opposed to really understanding risk and what risk plays in our lives and have always played in our lives? So, you know, being optimistic isn't to discount all of the terrible things and the toll that this has taken, but also to understand like what our strengths are personally and our communities, and the fact that the human race is a resilient species, and we're demonstrating this. And there's a lot of good signs, I think, in the last few months, and I hope it continues. But you know, we got to move on. I'll also just mention that. You know, the views I have, they're not necessarily the views of where I work. I'm not a infectious disease specialist. I'm not a virologist. I'm a practicing physician. I see people in the hospital. I see people in clinic. My patients have had COVID. My family has had COVID. I've seen lives touched by it in the entire spectrum. I think we can both take this extremely seriously and have a very sort of sober approach to policy, as well as being optimistic about just how lucky we are to live where we live in this country at this time, where there's no other time in human history I'd rather deal with a pandemic than now. When you think about all of the things that we have going for us, it's actually pretty impressive.
So this is why I love talking to you, because I will come over to your house and I'll talk about, something that we heard on the news, or something that's not going so well, or news that might not be the best in terms of COVID. And you'll always shine a brighter light. And so I just want to challenge you, and just so the audience can hear what our conversations sound like, but just to throw out the opposing perspective, why should we not believe the news? You said the news shows case counts and presents information. What about that bothers you, and what should we do about it?
Yeah, that's a great question. I think the challenge for everyone is understanding how a population number should be applied to an individual. So what's happening in the world and what's happening around the country, how does that affect my individual risk and the choices that I make? And I'll give an example. there was a time earlier on in the pandemic where newspapers were showing that the number of deaths have now exceeded the number of deaths in Vietnam. And, it's a crazy concept. Like, we had this massive war. It changed so much of our national discourse on the war that we engaged in and the outcomes. And of course, for every soldier that died, there was all types of long-term residual problems. The issue with that is it was not a comparison that, in my opinion, is valid for individual risk. The average age of someone who loses their life in war is very different than the average age of someone who loses their life to, and you name the diseases, heart disease, lung disease, stroke, and COVID. And so on an individual level, in our peer group among 30-somethings, 40-somethings, it's just not an appropriate comparison for lives lost as opposed to life years lost. I see this in the hospital all the time. The real challenge with cancer patients is they have a number of medical comorbid conditions. They tend to be older, and applying risk to that group is a completely different situation. And so, over the course of my day, what I'm doing with my young children in terms of risk reduction versus with my immunocompromised older cancer patients, it looks completely different. But as a society somehow, and reading the news, we're told like one size fits all about COVID and risk and what one needs to do about one's risk and how concerned we need to be. There were some other statistics that, people were off by a factor of tenfold or more on their perception of their likelihood of being hospitalized, right? So the reality is, again, for those who do not have major medical comorbidities and who are not older, if you have COVID, your chance of being hospitalized is less than 1%. Most people thought it was like 20, 30, 40% at various points during the pandemic. It's just very much off. And then, of course, when you extend that to children, it's yet another whole level of magnitude lower. And again, it's not to suggest that we shouldn't worry about COVID, but to quote, my mother-in-law, your mother, we shouldn't waste our worry. We have to have our worries in proportion to other things that affect our lives. Right. Taking that on, for young children, I looked this up in California statistics a year ago, so this may have changed, but at that point, mortality from COVID, if you compared it to things, and it's very rare for young children to die, but it's the type of thing that will keep a parent up at night with anxiety, there is a 6 times higher likelihood that a child would die from a drowning, and a 12 times higher likelihood that a child would die from a car accident. So if you're not spending a fraction of your time worried about COVID as you are for those other things, you're worried too much about the wrong things. And
but I'm very sympathetic. I hear what you're saying, and I agree with you. But at the same time, I feel for parents because that's all we've been hearing about, right? I mean, the news and the world that we're living in, and wearing masks all the time, and the rules and regulations. How I think it's really hard for us to not put more of our worries on COVID.
It's true, and I think it part of it gets to, I believe, the psychology of control and our desire to have control, even in times and contexts where we don't. So, as you mentioned, I deal with a lot of cancer patients, and the psychology of cancer I have found is it's this added injury of knowing that there's something that is a threat to one's life expectancy. It's that knowledge that adds level of anxiety that, something that is less predictable, the heart attack, the stroke, the traumatic injury. It's something that doesn't sit on our shoulders as much. With COVID being surrounded with the news cycle, and that's what anybody can talk about all the time, it's impossible not to feel this anxiety that there's nothing I can do, it's going to take over, we're going to get sick, when the reality is there's so many other things that are not occupying our mental bandwidth that aren't contributing to that anxiety. I don't know that there's an easy fix to it, but statistics can help. Being honest about the numbers and what our true risk is, and also what are the trade-offs in risk mitigation. So nothing is benign in terms of what we do. an example on the other side, I have a number of older patients for whom the social isolation for the initial year of the pandemic was probably a greater risk to them than so many other things that were happening with COVID. Is it to suggest that we shouldn't have policy to protect the older adults? Not at all. But that's where we should have the vast majority of our policy and our attention is to look at older adults and what we can do to reduce their risk. But if all of us are running around with the exact same, yardstick, then it's just a recipe for more anxiety without actually better outcomes.
I 100% agree with you. I mean, what I really like about your stance is you acknowledge that COVID is a risk and you take it seriously, but you also take seriously that there are side effects to over controlling or too much risk mitigation can also negatively affect our lives. And I think it's a great example about the elderly. I do feel like there's a lot of us out there that want to control this to the point where it's causing more harm than good, I would say.
Yeah, and you bring up a great point also about vaccination. I think many have commented on how poor the messaging has been about vaccination. I mean, when we talk about cause for optimism, the pace of the development and deployment of this vaccine is something we've never seen in human history. It's just an amazing thing. And look, there will have to be new versions. They're already being developed for the variants. This is going to be an annual cycle, but what a great time to be alive, where you can find, there's a disease that's ravaging the human population, and within a couple months you have a deployable vaccine that's just amazing. But as far as messaging, people weren't really proposed this as, this is a way to get back to your normal life. Right. Rather than just bashing individuals for having wanting to do their diligence and scrutinizing whether they want to take a vaccine, but just to say on an individual level, if what's important for you is to spend time with family and to get back to work and engage in your community, if this is a mechanism to do it, and that's the vaccine, like that's a really powerful message. Is it the end all be all? Of course not. The other problem is we mix things up too much. Like, instead of individual risk, then we were talking about group responsibility. Well, with Omicron, the vaccine is not exactly helping us with group responsibility. Those of us who are vaccinated are seeing, you can see this in the coastal cities, getting COVID at, rates that may even exceed those not vaccinated. And that's for many reasons. It's not because the vaccine is making people more susceptible to Omicron directly, but we're not, by vaccination alone, going to prevent this from spreading to those around us. We're addressing our individual risk and severity of disease. And that's the thing that's always really mattered. But the messaging around that hasn't been that way. Rather than saying this is an off-ramp and this is a way to get back to some semblance of a normal life, the messaging has been much more about fear and browbeating. And I hope that changes.
No, absolutely. Just to touch on a couple points you made, or to piggyback on some thoughts. So when you talk about how the vaccine, I think we should focus on what the vaccine can do, which is tremendous. It keeps us from getting really sick, from going to the hospital, even those that are elderly and medically fragile. I think a lot of people had hopes it would do more than that, that it would stop COVID, we would get to COVID zero. But honestly, I think that unfortunately the messaging there was, I guess in this situation, too optimistic, because the reality of respiratory viruses, so when I say a respiratory virus, that includes cold viruses, the flu, it's really impossible to make a perfect vaccine against a respiratory virus. That's why we don't have vaccines against colds, because they just mutate too quickly. We know that respiratory viruses, they change so quickly, we can't make it go away completely. So I think the expectation, unfortunately, was too high. But if you take a step back and really think about what the vaccine has done, it's been tremendously helpful. What we needed to do is keep people out of the hospital from getting really sick, from dying, and it's doing just that. So I do agree that the vaccine's been really a miracle for this pandemic. Then I wanted to talk about, when you were saying the speed at which it was made. I agree with you about this. I think a lot of us focus, or what I hear on the news is people are focusing on the Americans that have not yet been vaccinated, and we're focusing on those that haven't yet received the vaccine. But I think the other way to look at it is, wow, this vaccine was created in record time, deployed to hundreds of millions of people, and the fact that we've gotten over 70% of Americans fully vaccinated and 90+% of those over 60 fully vaccinated, those that are in the most vulnerable category, I think there's a lot of good there, right? There's a lot of good we can focus on.
There's a lot of good. And, in healthcare, we talk a lot about access. Access to care does not mean that you are compelling the patient to show up to their clinic visit. You're making it available to them. You're making screening available. You're making therapies available. It's going to be diminishing returns, again, back to the topic, on forcing people's hands with the vaccines, as opposed to allowing them to understand and to see for themselves, what it's allowing individuals and the society to do. So I agree with you. The other aspect that has had, in my opinion, not enough, let's say, optimistic messaging is, just because this is a novel virus doesn't mean we've thrown out the window, some of the benefits of natural immunity. And you combine that with vaccination, you're really getting a population that's developing the thing that we don't talk about enough, but I think we need to emphasize, which is resilience. There is no zero COVID. This is an endemic. This is on its way to being an endemic virus. The Spanish flu from over 100 years ago still lives with us today, in different variants. And so, our task is to be resilient to it, to decrease the burden of illness and to decrease the burden of sort of shutting down society and the economy. So with a combination of multiple things, including the vaccine, we should be resilient to it, as opposed to attempting to do zero COVID. There are a few countries that are still trying to hang on for zero COVID, and I think Omicron has basically taken them for a ride with that, because that's just not going to be possible if you're also going to maintain things like individual freedom, borders that allow families to reunite. I'm not sure that that's going to be possible.
Now, to challenge something you said earlier, that there's no better time to live with this disease. I don't know if I'm paraphrasing, you can correct me, but there's no better time that you would rather be living than now with this disease, that America is a great country to be living in with this disease. I'm just curious why you say that, because I think a lot of people have been really critical of America and how we're handling it and what's happening with COVID. Can you back up why you said that?
Yeah, it's a good point, and I think it's fair to challenge on that. We all know that our healthcare system is very much wanting in many respects, and part of the tension that we're going to have for a long time is, how does a country organized like ours address something that doesn't know state lines? Public health, particularly with pandemics, it's unclear that we really can have a state-by-state policy that makes sense. So, and of course, then there's the fragmented nature of our healthcare system and access, and the fact that, has COVID caused disparities in healthcare outcomes? It has not. It has just, thrown a magnifying glass on them. So we know that there are a lot of issues, but with all of the hand-wringing, you would think that our peer countries and the ones that we claim have so much more, sublimated ways of doing things, they're having the same outcomes that we are. And so basically, early on in the pandemic, we were seeing other developed nations, countries in Europe, ultimately having very similar trajectory, which is back to the point about control. We can do all of these mitigation strategies, but the pandemic is going to take left turns. We have to be humble about not being able to predict the future on these things. But for instance, ventilators, we mobilized, we already had a higher ICU per capita rate, a higher ventilator per capita rate than a number of countries that have the vaunted, national healthcare system. So there are things that are in our favor. We're a large country, right? We still, in spite of massive levels of income inequality, we still per capita have more wealth in this country than any other large country in the world, and we have access to healthcare in a way that most don't. I've been thinking we should have used at least part of our COVID relief budget to help other countries. It wouldn't take that much to help, for instance, their vaccination programs, and that's in our self-interest as well. It's a topic for another time, but we actually have quite a lot of resources and some surplus resources that you'd be hard-pressed to see citizens of other countries have that we do in terms of our access to healthcare. Is it perfect? Absolutely not. Are there disparities? Of course. But you know, when we were worried about having critically ill patients have sufficient ICU beds and ventilators, there was a real risk, and there was a lot of validity at that time to flattening the curve because of overwhelm. That calculus was much worse in almost every other country you look at. So rather than saying what is, all we can do is look at community spread levels, why aren't we looking at sort of how we can nimbly increase facility, hospital, and staffing capacity? These aren't easy questions, but to say that it's just static, it's not a creative enough solution. About 15, 20 years ago, the healthcare industry decided we had too many hospital beds. A lot of hospitals closed. They didn't think that the economics were there. Well, that's clearly not true in a time of a pandemic. We need to be able to flex up. And we can learn from other countries on it, but I think we still have so many strengths in our system to date that are, in many cases, overlooked. Yeah, and we have to really tip our hats to all the researchers who, and the openness of sharing information. That's another reason why I'm happy to be alive now. Through the internet, through Zoom meetings that take place instead of waiting 3 months for a medical conference, COVID advances are being communicated real time. And so, I don't think there's been enough attention and resources placed on therapeutics, but already we have, 2 FDA approvals. A year from now, we're going to have, very detailed algorithms across risk groups of, how we need to treat patients and not just wait until you get severe symptoms before you do some type of treatment. It's already started. Has it been enough? Probably not. But never before has there been a pace of inquiry and also sharing discovery as there is right now. It's very real time, and a lot of things to do. We have to look at our regulatory process, right? Like, are we looking at it fast enough? Are we balancing that with the public's concern about risk benefit? These are all policy questions, but again, we've made a lot of strides. I don't think any health system in any other part of history would have been able to do this so quickly.
I hope people listening can see why I love talking to you. It could be worse.
We also have to, we exercise in order to strengthen our bodies to be resilient to chronic disease or potential future injuries, right? As a society, we have to think about that as well. If this is the level of sort of widespread societal fear borne by this type of virus, like what are we doing to steel up our resilience for the next? Again, like referring back to an earlier epidemic or pandemic, the polio virus would pick off the young children much more preferentially. So we have to steel ourselves up for future diseases, and part of that is a resilience also in how we conduct our policy choices and what we do as a society, because this is just going to be a function of the human existence from time to time, and we have to be prepared in a way that allows us to continue to function.
It's an excellent point. Now, just to ask you, if you could make any changes right now with your optimistic perspective at how we're handling the current situation, if you could do it, what would you change?
I'd say broadly, we should apply our policies by risk groups or at least by age ranges. So I say this as a parent of young children, and I don't think enough attention has been paid to their suffering in terms of emotional development and educational outcomes. And those have real world, economic and even health implications, right? And so before we say that there's no trade-off to school closures or to separating, physically separating young children and forcing them to wear masks, including outside. We should really think about like what are the generational long-term effects of that. So I'd like to not paint this with one brushstroke and be much more targeted in which populations we're really talking about. A policy that applies to a nursing home just can't apply to a preschool. This is just unacceptable, and we need to call that out and advocate for vulnerable members of our society. That goes for older adults. That goes for children. And there's a completely different equation that I think we should use for both groups. We haven't so far, but it's time to start.
I think I couldn't agree with you more. I think what's hard is there's been a message out there that every life matters and that we shouldn't distinguish, from those with comorbidities and the young and the healthy, because every life matters. But I do think there is a distinction. Of course, every life matters, but if you're parenting young, healthy kids, and I know that it's healthy for those children to, participate in school and see friends and socialize, I do think it's psychologically helpful to know how low their risk of COVID complications are, because they really are truly astonishingly low.
Yeah.
I think when you take out kids that are, if you have health, just to relay those statistics, if you have children that are healthy, they have no other pre-existing health conditions, their risk of death is 1 in a million. And I've read that from the UK. I've read that from other countries. Those are astonishingly reassuring numbers. And again, of course, every life matters, and every child and every life matters. But I do think it's helpful to know, truly how low risk children are as we start to move forward and hopefully lessen some of these restrictive measures.
Yeah, and when we, in my anecdotal experience talking to older adults, the majority of my patients are older adults. When presented with trade-offs that are impacting young children, I have yet to hear one say that the trade-offs of applying one blanket policy are worth it. We should be careful in not thinking we're speaking on behalf of older adults and let them speak for themselves. Speak about what they want for their own lives, what they want for their grandchildren. And again, fortunately, we have certain tools where we can make decisions as individuals and within our families. And that's hard, because we have multi-generations. This is not easy, but we should be empowered to do so. And not shamed into thinking that if we don't do a one-size-fits-all approach, that's somehow equivalent to us not treating each life as precious. Of course it is. But how we function as a society is just as important, if not more important, to our long-term health as a society, and it can't be ignored.
Thank you for coming on. I really appreciate your time, and I look forward to seeing you soon.